Parkinson's disease is a progressive disease, and some of the symptoms may have an effect on your emotions. You may experience symptoms of depression, memory and cognitive problems, confusion and hallucinations. Depression is more common in patients with chronic diseases such as Parkinson's disease. 1/3 to nearly half of the patients with Parkinson's disease may experience depression at some time during their illness. Symptoms of depression may go unnoticed and untreated. You should inform your healthcare team if you feel that you may be suffering from depression. Some of the symptoms of depression may include feeling sad, lack of interest, feeling of worthlessness or guilt, fatigue or lack of energy, change in appetite, weight, sleep and mood pattern. There are a number of factors that can be related to depression, such as family history of depression, being elderly, experiencing difficult life events and stress. Parkinson's disease generally affects an older age group, which may be more vulnerable to depression because of events like retirement and passing away of friends and family. Loss of certain chemicals in brain such as serotonin and norepinephrine may play a role in causing depression. If you are going through a difficult time in life, try to detach yourself from the situation if you can. You should try to do something you enjoy and make you feel better about yourself. If the stress is from an ongoing situation, you should first let others know about it. In particular, you should come up with a way of minimizing the impact of the situation on your life. Regular exercise is a great way to deal with depression, and it will also help your symptoms of Parkinson's disease. You should avoid alcohol-related products or take drugs that were not prescribed. Medical treatments of depression is often long-term. There are many drugs that can be used to treat depression, and you should talk to your physician about these. Memory problems and cognitive dysfunction are associated with Parkinson's disease and can be very bothersome. You can practice and plan ahead in order to minimize them. If you need to remember something, you should try and concentrate on actually making a memory, trying to picture it in your mind and relate it to something important in your life. Try not to be tense when you are trying to remember things. In this way, you will have an easier time to recall them later. You should stay positive. If you keep reminding yourself that you have a very bad memory, you are more likely to forget. A notepad can be handy, and you should use it to write down anything you may forget. For upcoming events and appointments, you should use a calendar to help keep track of those events. Another helpful tip is to build routines. Make an effort to always place things where they should be. It will be easier for you to locate them later. You should also discuss this with your physician, who may start you on medications if required after further testing. Visual hallucinations and confusion is also reported by a significant number of patients with Parkinson's disease. Some of the medications used to treat Parkinson's disease may cause hallucination. Therefore, you should discuss this with your physician, who may modify your treatment in order to minimize these symptoms. Visual hallucinations are more common when you are in an unfamiliar setting. If you have been recently having trouble with hallucination, you should try to stay in a location where you are accustomed to. Sometimes there may just be a shadow that may mistakenly be recognized as something else. Lights should be turned on in order to reduce these shadows at night. Adequate fluid intake and nutrition, improving nighttime sleep, and repeated orientation is also helpful. If you are a caregiver, you have to realize that a hallucination may seem very real to a patient in question. If the patient does not listen to the reason, then it may be better not to dispute it as long as the hallucination is not upsetting. So you should never argue with the patient, nor you should reinforce their hallucinations. However, if a patient does get disturbed and becomes violent, you should call for assistance and do your best to prevent serious injury. If needed, you should call 911. This information is provided for educational purposes only and should not be taken as a substitute of the advice and care provided by your physician.